You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Cathy Biase. Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Cathy Biase, and I'm an holistic nutritionist and a professional cancer coach. Today's episode is one that I think everyone needs to hear, because in a world where we have more access to health information than ever before, people are actually getting sicker, more confused, and more disconnected from their own bodies. We're constantly being told what to do by the internet, by headlines, and by well-meaning friends and family. But how do we actually know what's right for us? Today I'm joined by Dr. Matt Fontaine, a sports chiropractor with over 2 decades of experience working with everyone from professional athletes to members of the U.S. Armed Forces. His work focuses on something we don't talk enough about, and that's understanding how the body is built, how it breaks down, and most importantly, how to take ownership of our own health. In his new book, Only One Body, he challenges the idea that we should passively rely on a system that often treats symptoms instead of building true health, and instead shows us how to become our own best advocate. We dive into exercise, navigating healthcare, body mechanics and biology, and how to cut through the noise so you can actually make decisions that support your body for the long term. This is about moving from confusion to clarity and from reactive health to real, empowered well-being. Stay tuned. We'll be back in just a few minutes to start our conversation with Dr. Matt Fontaine. You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Cathy Biase. Welcome back to the Health Hub, everybody. Please do follow us on our social sites. We are on Instagram, X, and Facebook, and we are at the Health Hub RMC on all those locations. Matt, welcome to the show.
Thanks so much for having me, Cathy. Glad to be here.
The book is fantastic. I was given access to it before the show, so awesome. I really want to get right into it because I think that everything that we need to talk about will fall from this one question. You've been in the healthcare system a while. What pushed you to write this book?
Yeah, I think the biggest thing was the frustration of people becoming more and more disconnected with what's really going on with their bodies, with their physiology. And, I started doing a blog probably in 2009 or 10, and most of those articles came organically just through conversations with patients that we would have on a day-to-day basis. And topic would come up, questions asked, and I thought, hey, this is a great blog post because it's a common question that we get asked. And so we just started to kind of connect the dots, and I would say the book really had its genesis back 2010. I was just coming off my first decade in practice, and the frustration of watching people come in being given misinformation either from their other doctors or wherever, and then you have the explosion of the internet age and more information than any person can sift through, and these patients didn't have a knowledge base to be able to run that information through a filter. So that was really the main true north for it, was just to try to assimilate a primer for the human body, how we're built, how we break, why we break, what do we do when we do break, and then get into a little bit of how should we be training to train for life, to be fit, longevity, and that's really where it all started, was with the end user in mind, is providing the patient with the information that they need to have better communication with their healthcare providers on all fronts.
I find, the one thing you touched upon there about having a lot of information at our fingertips. And we do. We have a lot of information. However, sometimes I find that it's the question being asked that needs to be honed in on. Um, how do you deal with your patients, people that are coming in to see you, filtering, helping them to filter with all the information that's out there, helping to make sense of everything. A lot of people have a great confusion as to who to believe. So, how do you help people open up the window so that they can go through in the proper direction?
Well, one of the things that I try to do in the book is bring together subject matter experts in different topics throughout health and fitness, whether it be sleep, strength and conditioning, longevity, nutrition. So the very first thing I try to talk to patients about is, be cognizant of the source that you're going to. Look at their credentials. If you're taking healthcare advice, let's hopefully make sure you're taking that advice from a healthcare professional, whether that be a nurse practitioner, a physician's assistant, an orthopedic, a sports chiropractor. There's tons of people online and all different platforms that are not professionally licensed, and they're putting content out there. So I think it's just starting with the awareness, and people intuitively kind of realize that they need to be very judicious in terms of who they listen to online and the information that they digest. So typically the conversation will go something like, "Oh, I was told this by so and so, or I read this online." Then usually they'll offer to share me the link via email, which that gets cumbersome because as a physician full-time practice, you only have so much bandwidth to
Hmm.
go through and assimilate all this stuff. And that's usually what I will try to do is to guide them. If I'm making recommendations, we try to provide them with resources, whether it's workout related, rehab equipment that they need, trying to get them a good quality vendor. Because you can find anything on Amazon today. And if you at least give them some guidance to, hey, when you go to Amazon, follow these links. These are products that we've tested and used. And so it's a lot of just coaching day to day. And, we take it by case basis, but it usually starts with the question that they're asking or the comment that they're making based on their usually misconception of what's going on. And we try to connect the dots for them. A lot of times it's about putting pieces of information that other providers have said to them, and those pieces of information are usually accurate in a singular sense, but nobody has been able to connect the dots for these people.
Hmm.
And that's what we try to do on a day-to-day basis.
When one of I shouldn't say impetuses of the book, but one of the statements of your book is that the healthcare system is a sick system. Now, you're from the States, I'm in Canada, so the dollars and cents of it are different. But there is an underlying premise throughout integrative health that there is something awry with our healthcare system. For the average person listening to this, how do you explain this to them? Because I think that understanding that leads them into the direction of integrative health.
Yeah, I think it it probably doesn't come as much of a shock to the patients that I see down here in the States that they're seeing insurance premiums go up year after year. I mean, I just spoke to a lady yesterday in clinic. She says her and her family are paying $4,000 a month for insurance premiums. She just had a pain procedure and she said it's interesting. She goes, it feels like my insurance coverage is better this year. And I suspect it's because some things happened with regard to deductible. But the first procedure she had a very large out-of-pocket expense. And then she's had two other procedures since then. And the subsequent out-of-pocket has become less and less. And I'm not exactly sure why that is, but I think ultimately it comes down to just getting them to realize that the system, the way it's designed, uh, providers are beholden to whoever's footing the bill, which is usually the insurance carriers, and they do not have your best interest at hand because these are big businesses and they're beholden to shareholders and bottom line. So that puts the onus on the physicians. And it's interesting. I heard a advertisement for Merrick Health, and it said something to the effect of, your doctors are not interested in optimal health. They do care about you, but through the training and just the number of patients they're forced to see and the restrictions on what you can actually get authorized from these insurance companies, it really hinders the ability of physicians to do their craft and to investigate fully what's going on with patients with their biology and physiology. And I think once people come to the realization that they're going to have to take the lead because the best intentioned physicians just aren't going to be able to do it for them. Um, and so the key to starting down a path of being a healthier person and more fit and just hedging towards having a higher quality of life for as long as we can, that really starts with you being the most educated person you can be so you can have better conversations with your providers and pose questions when they make recommendations for courses of action that don't make sense to you. Whether that's just brushing you off with a prescription medication or they're, trying to make referrals for specialists that don't make sense to you. Um, the system is far beyond broken at this point, and we've just been kicking the can down the road. And I always like to tell patients, just because you got in to see a provider doesn't mean that a positive outcome was the result of it. And so I think our system is fairly good at moving large mass numbers of people in and out of clinics on a day-to-day basis. But at the end of the day, it's a lot of busy work, and I don't think we're really getting a lot of return on our investment for the money we're spending.
Well, what are the biggest mistakes you find that people make when they are trying to take control of their health? I think everybody has this notion now that you've got to ask the right questions. You do have to take some control of your health. But what are mistakes that we're making?
Well, it starts with a lot of people just they don't know what they don't know. So,
Hmm.
the kind of ignorance is bliss. My world focuses around musculoskeletal and neuromusculoskeletal. So we see a lot of spinal and extremity related issues. We treat a lot of peripheral nerve entrapments. A lot of the injuries that we see are misdiagnosed and mismanaged by other providers. And that can be something as simple as a low back pain patient with pain radiating down the leg. They're misdiagnosed as having sciatic pain and they're rushed off to getting MRIs and thrown into pain management. All the while, the patient has no idea what's going on with their body. A lot of these pain procedures don't work because the diagnosis wasn't accurate from the beginning. And because of their lack of knowledge, they don't even know the questions to ask or to put up the red flag and ask their primary care doctors, why am I going to see a spine surgeon? And how come I haven't been referred to a chiropractor or physical therapy first? So I think it starts with just a real lack of understanding. And, you know, science today has evolved to the point where specialties have become more and more siloed because of how complex anatomy and physiology and biotech have become, that we've lost sight of the basics to the human body. And so, that's one of the things we try to deliver in the book is to give people the basic primer so that they can, you know, put the brakes on and say, let's kind of reframe what we're looking at here and make sure that they're being given a precision diagnosis and that they're being referred to the proper people who can get them the help that they need. Because really, without that knowledge, they are beholden to whoever they see as a physician provider. And I just don't see patients asking very many questions at all. And the questions that they do ask are usually not the best questions they could be asking.
I don't know exactly what the system is like in the US, but I know here in Canada, I shouldn't even say that broadly, in Ontario, to see a specialist, you have to be referred to from your family physician. So that locks you into seeing a family physician, getting the checkup done and hoping that they will send you on to a specialist should you need it. Is there a way to build an integrative healthcare team that you see that doesn't rely on the direction of the family physician? Does that make sense?
Yeah, it's a great question. And it's very much, despite the fact that our payer system is different, that is exactly how it operates here in the States
Okay.
for the most part. Depending on the state, a patient may be able to go see a physical therapist for up to 21 days without a primary care referral, but that's a very short period of time, usually not sufficient to fix somebody. So at that 21-day mark, they're going to need to go see their primary and get that referral. But for sure, uh, pain management, surgical specialties, cardiology, endocrinology, most of those are going to require a referral if we're talking about the patient wanting to use their insurance coverage. Certainly, if you have the ability to pay out of pocket, you can go and do whatever you want.
Hmm.
Much the same as a lot of Canadians will cross the border to come down and get MRIs.
Right.
They don't want to wait. My wife's born and raised in Canada, and her family's still up there. So, I've known a lot of physicians up there over the years, so fairly familiar with how the system works. And unfortunately, people are waiting around for a lot of, what we would consider non-essential services. I mean, if you need an MRI for your knee, you can kind of wait according to what the system will say. Down here in the States, you're probably not going to need to wait that long to get an MRI as long as we can get it authorized. But that requires going to a primary care physician. They're going to send you out for x-rays, which is, the insurance companies are going to mandate that as a starting point. And if you're suspecting an internal derangement in the knee and a meniscal tear, x-ray is not going to be very helpful to that. So now we're spending maybe 100 or 150, $200 on an x-ray study that we really don't need. We could have put that money directly towards an MRI, but their job, the insurance carriers, is to try to limit utilization because therefore they keep more money in their pocket and it goes to the middleman. So that's exactly how the system is played. And then a typical scenario is patient goes to primary care for some neuromusculoskeletal complaint, shoulder pain, knee pain, hip pain. If it's a simple case as, somebody has really severe arthritis and they need to have a referral to a total hip replacement surgeon, great. We do that. That surgeon usually is going to kick the patient back to physical therapy so that we can appease the insurance company by saying patients had 2 to 3 months of rehabilitation. All signs point to quality of life is still horrific. They're not sleeping well. Imaging shows end stage arthritis. It's time to do a total joint replacement. And then they can usually get authorization at that point. But that's a very extreme case. What about all the patients who have injuries that are not to that extreme where they don't require surgery? And a lot of times they'll get referred to physical therapy, then they get referred to the orthopedic surgeon who tells them, you'll need a total knee replacement at some point. So we'll just kind of let the body continue to deteriorate. And then they go to back to physical therapy and maybe they make some improvements, maybe they don't. And that cycle usually continues. Most patients down here in the States are not going to keep up with the exercises they get at physical therapy. And so you end up with a chronic problem becoming even more chronic in the process. And a lot of the patients that I see in my practice, they've been everywhere else and they've been dealing with whatever their injury, and it's usually multiple regions. They have, a hip problem, a knee problem, a shoulder problem, something going on in their neck or back. And they've just kind of capitulated to the fact that this is just how it's going to be. They've
Hmm.
seen all these other providers without a lot of answers. And so they just succumb to, well, this is just how I'm going to have to live the rest of my life. And it's unfortunate. It really doesn't have to be that way. So, like I said, the system is really geared towards just we're moving people through the system. And yes, they're seeing healthcare providers, but without a lot of effective outcomes.
But you also want to impose upon people the understanding that be ahead of the system, be ahead of your body breaking. You talk about how the body is built and then how the body breaks. What are the early signs that people are missing so that they don't get to the point where they're having a huge overhaul needed?
Yeah, it's a great question. I think first it starts with um, two different cohorts of people. You have people who are very active, um, and you can fill in the blank on what that looks like, from the CrossFitter to the avid pickleballer, the runner. These are people that are just working out every day. They're very active and they're engaged. And of course, that high volume training creates repetitive motion injuries that a lot of times they ignore or they try to exercise their way around it.
Hmm.
So aches and pains come up. They don't necessarily get in to see a professional, and they just kind of let these things fester until they become acute on top of chronic underlying issues. And then on the other end of the spectrum, we have the sedentary person who's not active at all and they're not moving. And we see them succumb to breakdown from lack of use. So, a lot of metabolic syndrome and obesity can play a big role in that. So there's kind of two different ends of the spectrum, and then a whole bunch of people that kind of fall in between in the middle. Um, so those are the two main groups that we tend to see. And again, it comes back to a lack of understanding of what exactly happens when we don't prioritize muscle balance, proper movement, joint alignment. Those are the biggest things that we see. And I talk about the triad of health in the book, and it's basically three things that can create disease or injury in the body, and it's structural insult, chemical, and emotional. And so on the chemical side, that's your body's physiology, the hormones, and all the different things that happen in the body's biochemistry. The emotional side is exactly what it sounds like, the mental and emotional well-being of the human structure, body and mind. And then on the structural side, that's your body chassis, so your bone, muscle, joint, and nerve system. And an insult to any one of those three will ultimately create some type of an issue. It could be a pain syndrome. It could be everything from just gastric upset, irritable bowel. It could be an actual orthopedic or neuromusculoskeletal injury. But those are the three things that can impact the body. And most patients today are probably dealing with two of those three areas where they have an issue. So, and unless somebody has had that explained to them, most people are not thinking in terms of the triad of health when they start having physical limitation or their body's breaking down on them. And a lot of these breakdowns happen so insidiously over time. It's like the putting a frog in a pan of lukewarm water and slowly turning up the boiling point. We don't really realize when these things happen. And then we wake up one day and we have this pain somewhere and we wonder where it came from.
Hmm. Um, before I ask my next question here, let's just take a quick break. We're at that point. When we come back, we'll continue on this conversation. We're going to talk about nutrition, other precepts that are in the book. So stay tuned, and we'll be back in just a couple of minutes.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Cathy Biase.
Welcome back to the Health Hub. My guest today is Dr. Matt Fontaine. Matt, we've said a lot, and I think there's a piece that needs to be spoken of to try and, put the period at the end of the sentence here. We want to be ahead of health issues. So when we're reading signals in our body that perhaps something is amiss, we've talked about difficulties with the healthcare system. Where do we go then? My knee is kind of aching. It's sort of not the way it was. It's not right. I think I might have tweaked it. This is the piece of the puzzle that I think needs to be really addressed because this is the sort of area of prevention before it gets to be a full-blown injury or illness or disease.
Yeah, 100%. The best way I can talk about it is to just walk through how we work up a case like that in our practice. We're very integrative in-house. We're fortunate enough to have chiropractic. We have acupuncture. We also have regenerative medicine in-house, and a lot of clinics that don't necessarily have regenerative medicine in-house, they'll have a regenerative medicine group that they work with. And when I say regenerative medicine, I'm talking about things like stem cells and platelet-rich plasma, the things that are going to help give the body the building blocks that it needs to repair tendon, cartilage, ligament damage, soft tissue injuries. So for us, it all starts with having a precision diagnosis. And so all of our docs are trained in what's called active release techniques. It's a soft tissue and fascia. It's really the gold standard out there. The training is very detailed on the anatomy, and its sole purpose is to restore gliding to areas that have become congested and glued down through repetitive motion. And about 80% of the symptoms that we see in office have some form of a peripheral nerve entrapment attached to that. And so a lot of people are going to immediately think to carpal tunnel, but I will tell you that carpal tunnel, when we look at the term in terms of statistics of patients we see, is actually pretty rare. The median nerve, which is a nerve that's oftentimes misdiagnosed as being trapped in the carpal tunnel, is actually more commonly entrapped further up in the forearm in a muscle called the pronator teres, and then further up into areas in the armpit and an area called the corticopectoral tunnel, where the nerves are coming out of the neck through the thoracic outlet, which is the space between your collarbone and your shoulder blade. And those nerves have to travel in through the armpit. So we see a ton of peripheral nerve entrapments that are often missed by all kinds of other providers, certainly primary care doctors. Patients have gone to physical therapy and may not have been diagnosed with peripheral nerve entrapments. So when we talk about a precision diagnosis, it really starts with very detailed anatomy and biomechanics of what's going on. If somebody's got some kind of benign knee pain, we're going to take a look at everything from the ankle up, because the knee is a basic hinge joint. And patients can have internal derangement, meaning there can be torn cartilage in there, otherwise known as the meniscus. And that can cause catching and clicking and just pain in the knee, weakness in the quadriceps. But sometimes patients just have basic misalignment through the knee that's putting stress on other soft tissues. And so we'll look at the foot and ankle, we'll look at the hip. So a physical medicine provider really needs to be looking globally at how the body's moving as a whole. And that comes back to the structural piece. So, and we're going to implement these active release technique protocols, which are very effective to restoring normal soft tissue movement and resolving these peripheral nerve entrapments. And a lot of patients see tremendous results just from that alone. But assuming a patient maybe has some more significant things going on, like for instance, tears inside of a knee joint, we'll get collaborative. We'll do imaging, X-ray, and MRI to diagnose accurately what's going on in the joint. And then we're going to collaborate. We're going to refer that patient to an orthopedic surgeon to have a consult. Most of the time for us, it's to check the box that we've done our due diligence, that the patient really doesn't require surgery, and that we're safe to track on a conservative course of action. And so if a patient, let's say, has a torn cartilage in their knee that's really impacting their quality of life, maybe they can't run anymore because of it. Maybe they're an avid pickleballer and they just can't play as much as they want because their knee just won't tolerate it. Then we'll advocate for them to be um, referred to regenerative medicine, and they'll go and have a consult because a lot of these patients will respond very well to regenerative medicine. Now, the only downside is it's usually an out-of-pocket cost. It's not covered by insurance. And a lot of patients will make the misconception that, well, it's not covered by insurance because maybe it's considered experimental. Well, the insurance companies consider a lot of things that have very found science behind them. They consider experimental basically because they don't want to pay for it. So, regenerative medicine has been around for a long, long time, 3 decades plus. Europe has probably been in front of us in terms of the states, in terms of how long they've been doing it. And the regenerative docs are getting very, very good at the procedures they're doing, and patients are responding extremely well. So When we talk about an integrative approach, depending on how broken somebody is, we may have to get involved with these different specialists. And it really requires having somebody as the field general to connect all these dots. And that's what we do in our practice every day, is to connect the dots for those people. So that's really kind of the biggest take home I can give a patient, is to kind of walk them through what does it really look like if I were to go through as a portal of entry into the healthcare system. Where
Mhm.
should I start? Well, if it's a neuromusculoskeletal problem, I would start with a really good chiropractor, making sure that they are collaborative and working with physical therapists, either in-house or with a physical therapy group that they work closely with. Acupuncture is another thing. It's very synergistic with the structural work that we do on the chiropractic side. And then regenerative medicine for those patients that require that. And then we leave the sub-surgical specialties to patients that are really broken and are potentially a surgical candidate.
Okay. Thank you for that, because I do think it's an important piece that we didn't quite hit on in the first part of the show. You call exercise, as well as many, many, many other people, a wonder drug. However, in listening to you speak and knowing your background is in the chiropractic field, exercise can also lead to some of these injuries and issues that you actually go and treat. So, people are coming to you saying, yeah, the pickleballer, for instance, who can't play pickleball anymore. And as we age and change and do certain things, people may tend to say, I'll just stop doing that. Um, how do you approach people in that regard? And with respect to exercise, are you suggesting that people find the right fit, or are we moving wrong? And that's the indicator of how we're getting these issues with our joints.
Great point. I would say first and foremost, for a lot of people, they're just not getting enough movement. So that's an easy fix. We get them walking, we get them doing stationary bike, and we get them moving. Hopefully, we get them in the gym with a trainer that they can have some one-on-one coaching, or maybe it's a group exercise class. And then for the mass majority of people, it's that we're moving, but we're moving incorrectly. And there's so many different reasons for why that happens. But the biggest thing is just muscle imbalance occurs over time from repetitive motion. If you think about doing a sport, a lot of those sports are going to be asymmetrically loading the body. We're doing repetitive movements, and it may be involving rotational and twisting and things like that. And then we just have injuries that stack over time. Somebody that picks up pickleball later on in life probably has had an injury or two, or three or four or more, that have stacked over time. And
Mhm.
now we're going into this pickleball where we're having to move in multi directions very quickly in some cases, fast acceleration and deceleration. And we probably are not training for that. I mean, if you look at professional and elite athletes get broken and injured, and they train full time professionally to do the sport that they do, what makes us think that we're going to come in, work in a full time job that's not a professional sport, and then come in and be a weekend warrior and play competitively for a few hours a week, and we haven't laid the foundation for that. So those are really the biggest things that we see. And again, that's the person that's not going to necessarily connect those dots as to why did my knee start hurting after I've been playing pickleball, or I've been running my whole life and now I can't run. So
Yeah.
when it comes to looking at how should we be training, and I talk about it in the book. And again, it depends on what you're training for, right? So we wrote this book for the average person who's training for life. You want to be as fit as possible for as long as possible. If you're a triathlete, an endurance athlete, or an ultra sport athlete, then your training is going to have to be molded around that. If you're somebody that does 50, 100-mile run, you need to train accordingly. We're talking more to the person who wants to be well-rounded and fit, and so we need to have strength training be a part of that on a weekly basis. We need to make sure we're doing zone 2 cardio, and that's for longevity. We need to be doing daily mobility and core stability training. And we need to be doing some kind of sprint high intensity interval training to build up our VO2 max. And there's a whole bunch of science behind why we do that, and we get into it in the book. People should also be doing yoga once a week, and that gets back to that movement practice and working on breath work. So I'm a big fan of yoga for a lot of reasons, but the mind-body connection and really being able to quiet the mind, focus on the breathing, and getting the body to touch ranges of motion that it wouldn't normally touch is invaluable. So for me personally, I use yoga as a recovery day, even though the yoga classes can tend to be pretty intense in terms of, it's moderately stressful, but we're moving the body in a restorative way to recover from all the work, hopefully, we've done over the course of the week and the months leading up to that.
Okay.
So for a lot of my patients, it's really just teaching them a basic framework to get them to think about what should they be doing from an exercise standpoint so they're working out smarter. And then within that framework, they have to modify it and customize it based on the needs of whatever their sport may be. If it's an avid golfer and they're coming into the golf season March, April, and they're going to golf all the way through October, we need to make sure we're doing the right things during the off season in terms of training their body to be able to handle that. And the cool thing about most athletics is there are commonalities that transcend all of these sports. Rotation being one thing, powers generated from the hips. So, how well somebody moves through their hips. Is their core strong enough to stabilize their lower back? Are they working on footwork for agility? All these things matter. Um, and so, we dedicated 2 or 3 chapters in the book to training smarter. How should we be training? And we really talk about a lot of these guidelines and giving people just a little bit of information that they can go and do a deeper dive if they choose to.
Do we need to be aware of our biology and how we train or what we are using as exercise, as well as does our training need to be modified as we move on in years?
Yes to all of those, right? So there are inherent differences between men and women. I would highlight Dr. Stacy Sims, and I mentioned her in the book. She's one of the experts out there on all
She's great.
things women, and the nuances between men and women, and the way that women need to be training, especially when you're getting into perimenopause and menopause, looking at bone density issues. And she talks a lot about women need to be doing jump training, sprint training, and heavy resistance training. And I would argue absolutely men need to be doing the same thing, albeit the reasons can be a little bit different. There are biological differences that we need to pay attention to in terms of how are we doing our nutrition. And one of the biggest things that I see that needs to be implemented, especially if somebody's getting later on in life and they never were really into strength training, is we need to start incorporating that. I ran into a relative in the gym the other day, um, just turned 80, was athletic most of his life, and just recently, probably in the last decade, started doing real strength training. And it's unbelievable the impact that will make just in
Mhm.
everything in terms of fall prevention. If you do fall, you're more likely to fare much better if you've been doing strength training. So I don't think we need to look at the decades that stack up that, hey, I can't do XYZ anymore. We just need to be smarter about how we approach it, how we approach axially loading our spine. So think about putting things like a back squat, heavy loaded bar on your back. That might not be the smartest thing to do with an aging person, but we can find other ways of doing strength training, lunges, for instance. So
Mhm.
strength training still needs to be there with some modification that we may have to work around somebody with an arthritic shoulder or degenerative disc arthritis in their back or neck. Whatever the case may be, that's where the individual needs to have a customized plan, and they can talk that over with their personal trainer. I think personal trainers in gyms should have a working relationship with local physicians, especially on the chiropractic side and physical therapy side, because these are the type of things that they're seeing. And they need to be able to have professionals that they can reach out to and bounce ideas off of I always tell patients who are working with a trainer, if need be, feel free to have them reach out to me, and I'm happy to talk to them about what we're working on, and we can put our heads together to collaborate on what's the best type of exercises we should be doing for that person. So a framework is really beneficial because it allows us to apply that over a broad spectrum of people, but then it comes down to the individual themselves, and
Mm-hmm.
there are nuances that we need to address. But the biggest thing is, I think strength training needs to be implemented at least twice a week. We need to be doing some zone two, and that's for your longevity, for your mitochondrial function. Think about like 40 minutes to an hour on a bike at a pace that you could still carry on a conversation. That could be a long walk. And then movement daily. And we talk about these things in the book, hydration, sleep. We need to prioritize all these
Mm-hmm.
things. And if we're checking
Absolutely.
these boxes and we're consistently doing some things for each of these category consistently well, that's much more important than focusing on doing 10,000 things.
Yeah, and then you end up getting frustrated.
Right.
Um, you talked about food as fuel. We know about that. That's something that is we talked about a lot here on the show. But with respect to integrating biological differences and food and fueling and men and women, because you touched on that, can you talk a bit about your advice for or the difference between men and women when it comes to fueling our body to do what we need to do in the gym, and also where recovery time plays a role in this? You know, you talk about movement every day. Depending on what your big days are, your recovery may look different from somebody else's. So, in general terms, can you help us with that piece?
Yeah, so from a recovery standpoint, I mean, one of the biggest things that I try to invoke on patients is start tracking your weeks in terms of what you're doing. Now, you can get deep dive into that. I have an Excel sheet that I use, and I will detail down to the specific exercises that I did. But it may be as simple as just putting strength down on a day, and you know that's a day you did strength training. The days that you bike or you swim or you run. Everybody's different. I had a patient in the office yesterday. He's been lifeguarding most of his adult life, and now that he's retired, he's still lifeguarding. Swims 3 or 4 days a week. Had a little slip on the ice and tweaked his knee, so we were working on it. And we were touching on some things recovery wise, and I think it's important to just have a good established baseline, and that comes from just getting into the activities and starting to know how your body responds. A few weeks ago, I had a patient who, he tweaked his lower back, had a long flight coast to coast, and was supposed to deadlift heavy per his personal trainer's instructions. And I said to him, I said, look, I'm never looking to try to tell a person they shouldn't do something, but let's just have this conversation because I think it makes sense. I think you're a little too acute right now to be trying to do a personal record deadlift in 2 days from now. We might want to push that a week, give yourself time to recover, and that might prevent us from having an injury that puts you out of the gym for 3 months.
Mm-hmm.
So I think just a mindset is getting people to think, just because your programming says today I'm going to go in the gym and squat, if your lower back is telling you not today, we need to respect that. And it's very difficult to do that. So on a training standpoint, that's one thing that I would say is the more you know your body and how it responds, and the more you listen to your body, we're able to make better decisions as far as what we're doing from an exercise standpoint day to day. When it comes to the differences between men and women, I mean, really, I would advocate and encourage, especially women, to seek out Dr. Stacy Sims. She's got a lot of great content on there, but she talks about the differences in feeding window, right? So, I was always under the impression that, hey, you have a feeding window of about an hour after you work out and strength train to replenish muscle glycogen and get amino acids on board because the body is going to be insulin sensitive and we want to get fuel into those working tissues that we just worked. She says that for men, that window can be up to 3 hours, but women, it's really important. And she's a big advocate of women eating in the morning before they go to work out. And the reasons for that are spikes in cortisol, and the physiology is different, and women really don't do well in a fasted state as far as working out goes. And she gets into a lot of the reasons why. So I'm just kind of reporting the news.
Mhm.
So that's one thing that I would say is really important to look at, especially if you're a woman that's in that perimenopause and menopause, postmenopause. How you look at your pre-workout nutrition is very, very important. And she gets into a lot of this physiology. The reason that women tend to not do as well with ice baths as compared to saunas, and it's got a
Right.
lot to do again with the physiology and being catabolic. We want to try to stay in an anabolic state. So, I have a lot of women in my life that are in that age group, including a lot of my patients. And so I've just been trying to, like I said, report the news and advocate for them to start to digest some of her content, because I think it's invaluable. The way that she simplifies very complex physiology in a way that is practical and easy to implement for women out there, that I just can't say enough good things about it.
Hmm.
So,
I agree with you on that. Okay, Matt, your book is called Only One Body. Where can we find it? And can you give us your social media handles if people want to reach out and talk to you, all that important information?
yeah, so the book, it's available on Amazon in paperback, Kindle, and audio. It's also up on Spotify in audio version. And I have a YouTube channel and Instagram. It's all Dr. Matt Fontaine. So on Instagram, it's at Dr. Matt Fontaine, and YouTube channel, Dr. Matt Fontaine. We also have a website, Dr. Matt Fontaine. It's currently being worked on right now, so it's under construction, but we have some really good resources there as well. The YouTube channel is a pretty comprehensive library of exercises and short videos where we talk about injury complexes and more patient education type of things. And it's organized into playlists. So we have playlists on mobility, we have playlists for core strength. It's not designed to be a strength and conditioning platform. We don't sell memberships, but really the YouTube channel was built out of a necessity to have a resource for our patients when we're prescribing exercises in office. We needed them to have the ability to have a video resource that they could refer back to, because very seldom are they going to be able to remember everything we show them in the office. And that's been an invaluable tool for us to be able to prescribe an exercise and then show them, hey, here's where the video is. And I always tell them, just watch the video, hit pause, go and do it, and do that until you have ownership of that movement. And now you've gained a life skill. So it's really just about trying to build out people's exercise vocabulary and their knowledge base.
Perfect. Perfect.
Yeah.
Well, thank you so much. It's been a pleasure chatting with you today. Lots of great information, and I appreciate you donating your time to us.
Thanks so much for having me on. It was a lot of fun. I'm honored to be here.
Thank you. And everybody, we'll talk to you next week on the Health Hub.
You have been listening to The Health Hub, hosted by Cathy Biase, here on Radio Maria Canada.